of this webinar series for 2015. There will be the same 5 starting in January 2016. I'm joined again with Stacy from Halo Chio. She's going to be giving you the presentation today once again. Just another few housekeeping items. If you have any questions throughout the presentation, no problem. You are all on mute, so you'll have to type the questions into the questions dialog. If you are having trouble with that, then feel free just to enter it in the chat, and Stacy and myself will see it, and then we can answer the questions at the end. So Stacy, if you want to introduce yourself and what we're going to be chatting about today, over to you.
Awesome. Thanks so much, Brett. Really appreciate it. Thanks again, everyone, for coming and attending our webinar, the last one of our physical literacy series. Again, Brett mentioned that we'll be doing another one in the winter, but this is our last one of 2015, so it's very exciting. Today I'm going to be talking to you guys about putting physical literacy within reach. So you can see the acronym there: recreation, education, allied health, coaching, and healthcare. It's kind of I guess, a branch of our Canadian Assessment of Physical Literacy, so I'm just going to talk to you about that. But before I do, a little intro on me for those who have not attended the webinars before. I'm a research coordinator here at Halo Chio at the Research Institute, and I've been working on CAPEL things for quite a while, since about January 2013. And on this particular project, which I'll speak to you about today, which started back in December 2013, I believe it was, and then into 2014. So I have vast experience on physical literacy and physical literacy assessment, so hopefully I can answer any questions you have. And without further ado, I guess we can get started. All right, so that was the intro on me, but I guess I should also give you an intro on Halo and the Chio Research Institute. So we are the Healthy Active Living and Obesity Research Group. For those who have not heard of us, we basically do research with kids and physical activity, also related to other behaviors such as sleep and nutrition, sedentary behaviors as well. We have a lot of research that we put out throughout the year, so if you ever want to find out more, you can go to our website, and we also have our Twitter handle there where we are going to tweet out any publications that we come out with or any news that we become aware of. But yeah, we're a group out of the Chio Research Institute, as I mentioned, so just a little intro about us. So here we go. We'll move on to the next slide, and we'll talk about the agenda. So first, for those who haven't come to the webinar before, I'm just going to do a brief definition of physical literacy. Then I'll talk to you about the putting physical literacy within reach objectives and the screening task options that came out of that project. So both option number 1, option 2, I'll go through the training materials that we have available, a little bit on the accuracy of the screening tasks, and then just finish off with some conclusions, and then take any questions at the end. All right, so moving on to the definition of physical literacy. So this is something I've gone through each of the webinars before, just as a quick refresher for everybody in case you weren't aware of the new definition that we have. So it just came out in June of 2015 at the Vancouver Physical Literacy Conference, and Participation actually got different groups together to come up with a consensus statement. So these groups have now adopted this International Physical Literacy Association definition. So you can see it on your screen there. Physical literacy is the motivation, confidence, physical competence, knowledge and understanding to value and take responsibility for engagement in physical activities for life. So it's actually very good that we now have a definition that is agreed upon by so many different groups. So now we can actually use this definition and work from it and build upon it from there. So you've probably seen this definition before, and if you haven't, you can definitely check out Participaction's website, and you can actually endorse the consensus statement as well yourselves, and just share it with your organizations as well. So just a few just to review the definition with the CAPEL domains. So for those who didn't join us for the CAPEL webinars, so again, standing for the Canadian Assessment of Physical Literacy, we essentially have 4 domains that we look at within our assessment tool. You can see them on your screen there in our little Venn diagram model here. And as you can see, each portion of the definition for physical literacy is represented with one of our 4 domains. So we have physical competence, knowledge and understanding, motivation and confidence, and daily behavior. For the rest of the presentation, I'm actually just going to speak to physical literacy screening tasks that we've come up with, but I just wanted to kind of give you a review of the CAPL domains because I will speak about CAPL a little bit, so in case you're not aware of CAPL, you can check out our website, and the URL will be at the end of the presentation, but just to give you kind of a sense of what the tool is and how we kind of used it to come up with the screening task itself. Okay, so putting physical literacy within reach. This was a project that we, again, worked on, started December 2013 and into 2014. I kind of came in on the project in the first stage of it, and I'm going to go through those stages with you. But essentially, the project was to come up with screening tasks for physical literacy. And there it is. So the goal for the project was to enhance the recreation, education, allied health, coaching, and healthcare sectors' capacity to screen children for important physical literacy deficits. So we mentioned the acronym REACH before during the title slide. So again, REACH stands for Recreation, Education, Allied Health, Coaching, and Healthcare. So the idea here is we know that we want to try to reach those sectors when it comes to physical literacy because in some way, shape, or form, people who are working within those sectors are going to encounter children's physical literacy or are going to need to help develop physical literacy. So we wanted to try to provide a tool for those groups that was going to be something that could identify children within the lowest 10th percentile or below. And when I say the lowest 10th percentile, I mean scoring with CAPL on the lowest 10th percentile. So that'll make a little bit more sense as I talk about how we went through the project. But just to give you a sense of, we're basically just trying to identify the kids who are kind of struggling on their physical literacy journey in a very quick and easy way. Okay, so this slide is just to give you a visual representation of how we went through the project itself. So the first, there are essentially 5 objectives. You can see those with the 5 bubbles there. The first objective was to actually come up with expert consensus on the screening tasks. So we had a meeting back in December 2013 with experts in each of the 5 sectors, and we also invited some research people as well. So we had people from recreation, education, allied health, coaching, and healthcare, and research, just asking them what they thought a screening task for physical literacy, what it should look like, and how quick it should be, what were the necessary components of what it needed to look like, essentially. So once we had that, we were able to kind of send out, I guess, questionnaires to these experts to then let them decide through a consensus process what needed to be included. So once that was determined, we were able to kind of go through with an environmental scan to figure out which screening tasks would be appropriate based on the consensus that the experts had come together to conclude on. So once we had those screening tasks, we then tested the accuracy of these screening tasks with CAPL. So CAPL, again, is a valid and reliable physical literacy assessment for children 8 to 12 years of age. So we're using this as our comparison, essentially, because we know it's valid and reliable. So we then went to test children in the age group of 8 to 12 with CAPL and with the screening tasks, and then did comparison between their scores to find the children who were in the lowest 10th percentile and could then be used or screened with the screening tasks. So once we had those figured out, we wanted to then make sure that these were feasible within the REACH sectors themselves. So we asked a number of different leaders in the REACH sector to actually go out and try them out with their own kids in their programs, and then provide feedback on training materials that we provided. So we went through a few rounds of giving training materials out, got feedback from our participants, and then changed the training materials as you see. We'll see them now. And again, they'll be available on the website, and you'll see them a little bit later in the presentation. So once that was the third objective. The fourth objective was to then establish reliability of the screening tasks. This one, we went out to a couple different schools and recreation organizations to test the reliability of the screening tasks. I'm not going to talk about that one today, only because we're still doing additional testing with this, only because we weren't quite sure which screening tasks we were going to move forward with. So there are different stages of testing that we went through, and therefore different reliabilities. So we're still working on actually testing the current physical literacy screening tasks we have. So hopefully that will come out a little bit later this year once we have that data available. So then the fifth objective was then to build capacity and then assess the feasibility of screening tasks within each of those sectors. So we then sent out a questionnaire to our partners and our participants from each of those REACH sectors to kind of ask them if these screening tasks were feasible, and the general consensus was they were. It's also, this webinar is then part of the building capacity, so letting you guys know about the screening tasks and how you can now use them in your programs and organizations. But yeah, if you have any questions about these objectives of the project, feel free to ask me at the end, just to give you guys a context of how we kind of created these screening tasks. The rest of the webinar will now just be about the screening tasks themselves and what they look like. So again, this is to give you a little bit of background. So sometimes it's not always possible to use the CAPL because we know that each recreation or each sector, so including recreation, education, allied health, coaching, and healthcare, there's a lot of needs and different resources that are available for these sectors. So we knew that we wanted to, or we needed to, kind of reach everybody at the same level and make sure that people in the healthcare sector with you know, limited space, for example, would still be able to do these screening tasks even if they didn't have the space and equipment needed. So from that, the screening task would be a really quick and easy way to assess a large group of children for the physical literacy deficits or those who are struggling on their journey that we were talking about. So again, making sure that people in the recreation sector, for example, who generally work with a large number of children, could test them quickly or screen them quickly, as well as you know, maybe an allied health professional like a physiotherapist or a healthcare professional such as a nurse or a doctor who don't have a lot of time, who just want to quickly screen children that they might see throughout their practice. So from there, the ideal situation essentially would be to, after these kids with who are struggling on their journey have been identified, the CAPL would then be used to further assess the child to see which areas of physical literacy they may be struggling on. So again, that's kind of out of the scope of our project, but that's kind of the way we saw it working, or how we see it working in the field. So for example, the screening tasks that I'm going to tell you about today, you can easily integrate those into your programs, and then depending on your capacity, you could then do a full assessment of CAPL, or you can work with your partners to kind of bring resources together to do a full assessment. So that's kind of where we saw the screening tasks fitting into the whole picture of CAPL. And this is just to give you a little bit of a visual. So again, you would have the screening tasks and figure out which child would need to do the full CAPL and which children would not need to do that, depending on the outcome of the assessment or the screening task. Okay, so you guys are always probably already wondering what the screening tasks options are. So I'm going to go through those and I have a couple of videos for you just to give you visuals on what they look like. Again, if you have any questions about them, feel free to put a question in the chat bar, and then I will be happy to answer it at the end of the presentation. Okay, so these are the two options that we have. Option 1 is space to run. Option 2 is limited space. So option 1, if you have space to run, so that means if you have a space that is 7 by 1 meter minimum for children to run, you can use these tasks in less than 1 minute per child. So the tasks would be to have the children answer an activity question and then complete the Play Tools Run Level 2. And that would be the assessment, again, happening within 1 minute per child. The option 2, it'd be if you have limited space. If you don't have that 7 by 1 meter minimum space, You would then do the limited space option, so answering 2 parent support questions and then having the child complete the wall sit. So again, this would probably take less than 3 minutes for a group of children. So we wanted to create 2 options because we know that each sector is going to have different needs and resources available. So we wanted to make sure that people had different options available to them to accommodate their certain situations. So that's why we have the 2 options, and I'll go through those and kind of the pros and cons for using each option. Okay, so option 1, this is Space 2 Run. So the first one is the answer an activity question. So the question that we would ask the child would be, compared to other kids your age, how active are you? So then they would circle one number, 1 to 10, 1 being a lot less active, 5 being the same, and then 10 being a lot more active. So this could be done verbally. It could be done by providing them with a written form, whatever is easier for you as the administrator, but again, something very simple that can be quickly asked to the child. So this is just the instructions to the participant. So kind of using what we use in our CAPEL knowledge questionnaire. So basically just saying we want to know how active you are compared to other children your age. And we want them to circle just one answer that represents how active they are. So I've already gone through. So 1 being you are a lot less active than other children your age. 5, your activity is the same as other children. 10, you are a lot more active than other children. So the emphasis here is we want to know the child's honest opinion. There's no right or wrong answer here. We just want to know what the child thinks. And just kind of in relation to that, when we were doing testing ourselves, we know that especially if you have a large group of children, they're going to maybe, their answer might depend on those who are around them. So we suggest that you actually bring the child a little bit further away than their peers to answer this if you're going to do something verbal. If you're going to do written, just make sure that they have ample space around them and make sure that others can't see their answer, because we know that that might change the opinion of the child based on their friend's answer or their peer's answer. So just a kind of a tip or trick for when you might want to use this assessment. And again, it's one of those things that if they don't understand the question, they can ask for help, and we're going to help them through as well. Okay, so what do the results mean? So essentially, if a child answers less than 5 on that question, you would then continue to step 2. So the way our options work, they're like a stepwise protocol, if you will. So if the child gets through step 1, or if they answer greater on that 5 or greater on that activity question, then they don't actually need to complete the next step of the assessment. Because it would be assumed that if they got 5 or greater on this question, they would also pass the running task as well. So again, if they answered less, though, you would move on to that next portion. So you can kind of see how quickly the screening task would work depending on what the answer of the child would be. Okay, so if they, again, answer less than 5 on that question, then you would move to the Play Tools Run Level 2. So we used, I think, an older version of the Play Tools. If I'm not mistaken, they might have changed things now, and this one may or may not be still part of their program. But we found that it did work for a screening task purpose. So I'm just going to go through what that looks like, and we're going to have a video of what you'd be looking for when you administer this screening task. So first, the instructions to the participant. Basically, you're going to have 2 pylons set up, about 7 meters in length. So 1 pylon where the participant starts, and then 7 meters in a straight line ahead. So the participant's going to run in a straight line to the pylon, stop at the pylon, and then run backwards back from the pylon to the starting pylon where they began. So I'm just going to click this, and you guys can see a video of what that looks like. I do know that these participants are not actually children. They are from our lab, but just wanted to use them for instructional purposes. So I'll just start the video now. I don't think we're going to have audio, but I'll just run you through kind of what it looks like. Emily's just explaining what they'll have to do. They're going to demo for the child there, and she'll come back and then stop at the pylon. So this is what it would look like if the child would run. So straight to the pylon, stop, and then back. Again, you'd probably want a little bit of a bigger space than this, although it does fit the space requirements that we did mention. And the child would be going full speed, which in this video, Audrey, who's our participant, isn't necessarily going full speed, but it's just to show you guys what it looks like. So with this, we are going to talk about how to describe a child's performance. So it's based on a rating system. So the rating system goes from 1 to 4. 1 is going to be as it is described there. So if the child stumbles, trips, or slips, their transitions aren't smooth, there's a little bit of disjointed movement, or they step over the line at the pylon, they're running a little bit slower, they would be rated as a 1. Rating 2 would be arms and legs are moving in sync, but only at some moments. They're, sliding or shuffling when they stop. There's a long stop at the pylon, so it's not as quick or smooth. So that would be rating 2. Rating 3, so they run in a straight line there and back. They have a good speed. Their running backwards isn't quite as good as running forwards, but there is a mature running form when they're running forwards. So that's rating 3. And then rating 4, they're sprinting to the pylons, they're accelerating, they're decelerating. Their backwards run is just as efficient as their forwards run. They're turning their head to face the direction of movement, and then their arms and legs are used with purpose. So you can kind of see the difference in the rating system here. Again, this one would require a little bit more practice just to get the nuances or just understand the rating system itself. But you could easily have a page set up with columns for each child, and then putting in either a 1, 2, 3, or 4, depending on the rating of that child. Okay, so those are the rating systems. So we're just going to go through now what those mean for the screening task itself. So if a child is rated less than 3 on his or her performance, a detailed assessment of the child's physical literacy is recommended. So this would be if they rated a 1, 2, or 1 or 2, I should say, and then you'd want to go through the full CAPLE with them just to see which areas of physical literacy they actually are struggling in. But if they rated 3 or more, so again, a 3 or a 4, a more in-depth assessment is not required. So that would mean that they would be above that lowest 10th percentile based on the screening task, and you would need to see what areas of physical literacy they need to develop. Although you could, CAPLE is available for everyone to use, so if you wanted to get a full assessment of that child, you're more than welcome to do so, even if they passed the screening task, if you will. So that's the first option that we have. Just a practitioner tip with this one. So it's very easy to incorporate the Play Tools run into your warm-up routine. So you can easily set up pylons across a field or gym and have the whole class or team run back and forth as a warm-up. Essentially, the child doesn't even need to know that this is an assessment. You can screen them very quickly all at once. Again, it depends on your organization if consent is needed for this type of assessment, but it doesn't really need to feel like an assessment. Like you can just easily incorporate it into a warm-up routine, and then you would just assess each child one at a time as the group runs back and forth. So very easily as a warm-up routine, probably already seen in coaching or in the recreation sectors. Okay, so that's the first option. Moving on to option number 2. So this is if you have limited space, so probably more suited towards the allied health sector or the healthcare sector, or depending on the space limitations you have in the other sectors. So first, the child would be asked to answer 2 parent support questions. So the questions there are, during a normal week, how often do your parents take you to play games or sports? So they have the option of saying never, not often, sometimes, often, or very often. Second question, during a normal week, how often do your parents play active games or sports with you? So again, they have the option of never, not often, sometimes, often, or very often. Again, you can give this either in a written format or you can ask the child verbally, whatever's easier for you and your organization. And again, if you're doing a large group of kids, it might be better to kind of have the kids answer separate from each other. That way they're not influencing each other's answers. Okay, so the instructions to the participant, very similar to the activity question. So we want to know how often your parents or guardians take you to play active games or are active with you in a normal week. Circle one answer for each question. There's no such thing as a right or wrong answer. We just want to know your opinion. And then, again, if they have any questions, they can ask you for any assistance. Again, though, we're not trying to leave the child with these. If they don't understand the question, we don't want to give them the answer. Just make sure we're just clarifying things and helping them through that sort of thing. Okay, so what do the results mean? So again, this is the stepwise fashion. So if a child answers either question as often or very often, a more in-depth physical literacy assessment is not required. But if the child answers both questions as never, not often, or sometimes, you then continue to the limited space step 2 option. So remember, it does say in bold there, so both options. So making sure you have the never, not often, or sometimes option there. Okay, there we go. With this one, the next one is step number 2. So again, if they answered the 3 options that we mentioned in that first option, you move to wall sit. So these are just the instructions you would have for the child. So standing with their back up against the wall, keeping their feet shoulder width apart, bending their knees and moving their body downward until their legs are bent at 90 degrees. So almost like they're sitting on an imaginary chair. And then hanging their arms freely at their sides, maintaining the position as long as possible. And then letting them know that we're going to stop timing as soon as the body is not in proper position, or if they stop trying, so if they give up. Also, if we're going to end the test if the child completes it at least 25 seconds. So that'll make sense a little bit later, but they don't need to go longer than 25 seconds. So a quick little video just to show you what we'd be looking for when we're doing the wall sit. I'm sure you guys have all completed the wall sit, if not a few times in your lifetime, but we'll just show you what that looks like. Again, there'll be no audio probably for you, but I'll just walk you through. So the assessor would give them the instructions, letting them know what to do. They would drop into the position and just letting them kind of feel for the position first, and then starting the time when they're ready, and then making sure that they are keeping the proper posture throughout. I'll show you in the next slide kind of the common errors that you might see where you need to give them a warning or stop the test. So yeah, there we go. So she's just given up. Again, I know that these aren't children in these videos, but we just wanted to give you an idea of what it would look like. And all these videos that I'm showing you today are available on our website, so if you have any questions about how to administer the tasks, they are available online. So these are the common errors for the wall sit. So the first one here, legs are not bent enough, so they're kind of sitting up a little bit straighter. Again, not going to be as difficult for them. Or in the opposite direction, legs are bent too much, so they're pretty close to the ground. And then another very common one, especially with the 8 to 12-year-olds, is they're going to have their hands on the knees. Kids are going to complain about this one. I can tell you in previous experience, they don't want to put their hands on their knees, but that's just because when you do that, it makes it a little easier. So just making sure that their hands are at their sides. Okay, so what do the results mean? So basically, if a participant scores less than 20 seconds on the wall sit, a detailed assessment of the child's physical literacy is recommended. So we have the example there of doing CAPEL. But if the child scores 20 seconds or longer, so there's why we're stopping them at 25 seconds. A more in-depth assessment is probably not required. So again, then they would pass the screening and they wouldn't have to do any further assessment. And just a quick practitioner tip. So this is very easily integrated into a group of class. You can just have everyone line up at the same time and start the timer at the same time, and then see who stops before the minimum amount of time. I've done this with a few groups now just to kind of show them how quick and easy the screening task is. Been able to do groups as large as 30, 40, and in less than 30 seconds. So it is one of those quick tasks that you can use and find out where if the child or a group of children need further physical literacy assessment. Okay, so I'm just going to show you what the training materials look like. Again, these are all available on the CAPEL website if you want to check back and kind of see how to actually go through and administer the tasks. So the instructions for the administration are going to be there for you, and then how to score and interpret the results are also going to be part of the training materials. And we're going to go through step by step how to actually administer the tasks and how to score them and interpret the results when you're screening both individuals or groups of participants. So it's very user-friendly. Again, this went through a process of feedback with our REACH sector participants. So it is easy to follow and should give you all the information that you need. It's about I'd say a 4 or 5 page document. Depending on which task you pick, you won't need to read the entire document itself. But we wanted to try to make it something that you wouldn't have to be spending your entire day reading. So it is something very quick to look at. Okay, so the accuracy of the physical literacy screening task. So that was actually available on the first, that page there that I just showed you on the left. So that's the first page of the training materials itself. So I'm just going to go through what that means and kind of go through a little bit of the pros and cons of each task with doing that. Okay, so the first one, space to run. So we have here is we have the step-wise options, so step 1 and 2. So step 1 being the activity question, and then step 2 being the play tools. We have the equipment space that you need, and then we also go through the accuracy of a pass not, and the accuracy of not passing. So this might be a little bit hard to grasp, but I'll try to explain it as best I can. So essentially, 90% of the children who pass will then be screened correctly. So that means whoever passed the activity question and would then be, like 90% of those would be screened correctly if we used CAPEL. So that means that 10% of the kids that we'd test using the screening task would actually not pass CAPEL, or and what I mean by pass CAPEL, they would actually be in that lowest 10 percentile, but we would not catch them with the screening task. So we do catch 90% of the kids who are in the lowest 10 percentile, but we do miss that 10% of kids. On the other side, accuracy of not passing, so 80% of the children who do not pass will be screened correctly. So that means if they didn't pass the activity question or the play tools run, 80% of the kids would be in that lowest 10th percentile if we were to test them using CAPEL. However, it does mean that 20% we're actually going to miss if we were to test them with CAPEL. They'd be in that lowest 10th percentile, even though they did, oh sorry, I think I messed that up in my head. So 80% of the kids who do not pass will be screened correctly, but 20% would actually pass. So meaning it would be a false positive. Sorry, I always mix them up, but that's what it means there. So if they didn't pass with the screening task, they would pass with CAPEL. So again, having that false positive. So this one is actually a little bit more accurate than the limited space option. So if you want to just move your eyes down a little bit further for that one, so the accuracy of a pass for the limited space option, so again, the answering the parent support questions, the wall sit, is actually 89%. So 89% of the kids who pass will be screened correctly. So those who did get the correct answers for the parent questions would also be in the highest or above that 10th percentile if we tested them with CAPEL. But 11% would actually be in the lowest 10th percentile. So we would have, we'd be missing about 11% of the kids. That being said, on the other side, so actually of not passing, so 67% of the children who do not pass will be screened correctly. So if they didn't pass the parent support questions, didn't pass the WALSIT, if we tested them with CAPEL, 67% of the kids would be in that lowest 10th percentile, but we'd actually get false positives for a larger portion than the space to run option. So again, the pros and cons of using both options. So the space to run, while the pro is more accurate, the con is it does take a little bit more space, whereas the limited space option, it takes less space, but the con would be it's less accurate than the space to run. Now, I should mention that we are planning to do some more validity testing with these options this winter. So we're hoping to increase our numbers because these numbers are based on a sample size of about 300. So we're hoping to increase that. Oh, I'm sorry, not 300. We tested 300, but it's only 150 or so. So it is a little bit of a smaller end. So we are trying to increase that number to see if the numbers do stay the same. So hopefully we'll have that information a little bit later on, perhaps in the summer or the fall. But we do need to test more children in the winter. But that being said, these tools are available for you to use with these accuracies in mind. Okay, so I'm a little bit quick, I think, on this webinar, but that'll just leave more time for questions and kind of get you on your way anyway. So just to conclude, we have now 2 quick and easy physical literacy screening tasks for children 8 to 12 years of age. And the children identified with the screening tasks, so again, who would not pass the screening test would then have to, or should have a comprehensive physical literacy assessment, so i.e. The CAPEL. So again, just kind of giving people more options if they don't have CAPEL available to them. They can at least screen the kids and then maybe refer out just to an organization that would have more resources available to them. So I'd just like to quickly acknowledge the Ontario Trillium Foundation for allowing us to, or helping us provide these webinars to you. Without funding from them, this project would not be possible. And also thank Participaction for partnering with us on this project. Again, without their help, this project wouldn't be possible. You can see there our CAPEL website is up online, and it'll be on the next slide as well. So if you ever have any questions about the screening tasks or CAPEL, you can go to the website and find out more. The screening tasks are actually under their own tab there, so they're easily found. I'm just going to leave you with my contact information. So if you ever have any questions about either the CAPEL or the screening tasks, you can give me a call at my extension, or you can send me an email. Again, if you want to check out the CAPEL website or the HALO website or our Twitter account, you are more than welcome to do so. But yeah, I think I will end it there. So a little early, but I'd be happy to take any questions that you might have.
Awesome. Thanks, Stacy. So we actually do have a couple questions.
Okay.
So the first one is, what's the difference between the CAPEL assessment tool and the PLAY assessment tool developed by CS4L?
Okay, yeah, that's a good question. I often get that question anytime I do a presentation. So essentially, the CAPEL was developed by HALO, and it's a research grade assessment tool. So it's, as I mentioned, valid and reliable. So we actually have a methods paper that just came out this summer that actually goes through the methods that we went through to come up with the assessment, also the consensus that we got from experts in the field of childhood physical activity that allowed us to come up with the domains that we mentioned. And we look at all 4 fundamental aspects of physical literacy. So we have physical competence, knowledge and understanding, motivation and confidence, and daily behavior. Whereas PLAY tools, they do very similar assessments to us as well. So they're going to look at fundamental motor skills in isolation. So it'll have things on throwing, kicking, running, as we saw with our screening task. Whereas CAPEL, we look at motor skills in a dynamic environment. So we actually have an assessment that's called the Canadian Agility and Movement Skill Assessment, or CAMSA is our acronym. And we're going to look at those skills in a dynamic environment. That's kind of been the main difference that we see. We have our methods paper that's come out to again show how it's valid and reliable. Yeah, so that's would be the difference between the two of us. So essentially what we're trying to do here is just going to give you options for using CAPEL, or if you want to use the play tools, that's okay too. We just want to make sure that organizations in the field are getting both options and can, or even other options as well, like PHE Canada's Passport for Life, have those options and decide which one is best for their organization and their needs and their resources. So I hope I answered your question.
Yeah, that was a great answer. Thanks, Stacey. A couple more questions. So for the screening task, how's a child scored if they step over the line but have mature running form?
Yeah, I think when we went through with the rating system, it is a little bit more subjective. So it would be like you use the rating system as best you can, but it would be kind of up to the administrator to kind of assess that. So if they have a mature running form and you see all of the other aspects of that rating there, but they did step over the line, I would still give them that higher rating than giving it a lower one. But again, it would be up to the administrator depending on what they saw. So I know that's not the best answer, but I think that would be the best one I could give you at this time.
The next is the descriptions of each level don't seem entirely progressive.
So for, I'm assuming this is for the play tools. So unfortunately, I won't be able to really talk too much about that rating system, in the sense that, as I mentioned, Halo didn't come up with the play tools run, so that would be a better question for the CS4L folks, because I don't want to kind of put you in one direction, because again, we just kind of used their tool and went with it. So yeah, I think that's the best answer I can give. So if you have any questions, I'd bring it to those folks and see if they can provide a better answer than I'm just giving you now.
Sure. And CS4L is known as the Sport for Life Society, and they can be found online.
Yeah.
You can get in touch with them. Yeah.
Yeah. If you contact Drew Mitchell, he'd probably be your best bet. He does a lot of workshops around that too, so I'm sure he'd be able to answer any of your questions related to that.
Right on. So for the folks who are wondering about that, if you wanted to, you could email Stacey, and then between the two of us, we could put you in touch with the right person if you wanted to know more. Has the validity of these screening tools been determined?
Yeah, so I talked about it a little bit. So as I mentioned, we tested about 300 kids with these screening tasks. So what we did is we tested them with the screening task and with CAPEL. So we would go in on 2 different days. So sometimes we would get kids to do both of the assessments, but sometimes they might be missing or not available. So we actually only have a full data set for about 150 of the kids. So the validity is based on that. So it's not quite valid as of yet, I would say. Like, there's still more work to be done because it is a small sample size, but we did want to make sure that that people have the opportunity to use these tasks if they wanted to. So we'll be updating that information as we get more data, as we test more kits. But the validity that you see there, so the accuracy of a pass versus a not passing, is correct based on that sample of 150 kids. So you can kind of do that, take that with what you will, I guess. And if you feel comfortable using it with that kind of information, then that's great. And if not, again, check back when we have more information and more data available.
Great. And someone just actually sent in the Sport for Life website, which is canadiansportforlife.ca, if anybody was interested. So one more question. Could you recommend an assessment tool for a younger population, either preschool or younger, and a resource that outlines stages, kids should be at a specific age as they develop.
Yeah, that's another question I get fairly often. Um, I know that with our assessment, it's only valid and reliable for, like CAPEL, I'm talking about, so valid and reliable for 8 to 12-year-olds. That wasn't our initial intention with our testing. We did try to test kids from 6 to 15, but only found that this assessment worked for those kids, and I guess same for our screening tasks as well. So we are working to hopefully extend that age group, so doing a questionnaire for grades 7, 8, and 9, and then after that we'll be working on the younger age group. At this time, we don't have anything available for the younger age group. I know there's a couple folks at McMaster that are working on one as well. I believe if you look on their website, you should be able to find it. If not, you could use the TGMD, which is another gross motor skill assessment. So something that's going to ask a child to dribble a basketball, kick a ball, throw a ball, those kinds of gross motor skills. So again, not necessarily getting at the full content of physical literacy, but it would at least give you information on their gross motor skills or their fundamental motor skills. So I think that, unfortunately, is the best answer I can give you. But if you do Google McMaster and physical literacy, you should come up with maybe some information that groups in McMaster are doing with that. But it's coming, hopefully, in the next couple of years from our group. So I hopefully will be able to give you a better answer a little bit later on.
Cool. So those are all the questions that we had. So I just wanted to thank everyone for joining us for the last webinar of this webinar series before it repeats itself in January 2016. And obviously, thank you, Stacy, for putting on a great presentation for the 5th time in a row. And that's it. So I hope everyone has a great day, and we will be chatting later.
Yeah, thank you so much, everyone, for participating. I really appreciate it. Have a good one.